Hello and welcome back. It is 2026 and let's talk about the Unaffordable Care Act. At least that's what I call it. Now in 2014, as we all know, Obama, he did care a lot for people who were unable to get health care coverage. So he put this Affordable Care Act in place in 2014. Now it was designed to help people with pre-existing conditions who could not get health care to acquire health care. He also was concerned about those people who couldn't afford health care because they didn't earn enough income to pay for health care, and health care has always been quite expensive. So I thought that was a wonderful thing that he did, definitely in support of it. So after COVID, the Affordable Health Care Act was extended, but then there were also additional subsidies that were given. Those additional subsidies were called the Enhanced Affordable Care Act premium tax credits. And many of us have benefited from those tax credits, not just lower income, but middle income Americans, business owners. This was a wonderful thing, right? So we thought that after the extension that they were going to continue to extend them. And it would have been nice in 2025 for them to extend them through 2026 or 2027. But unfortunately, Congress has not done that. Because the enhanced affordable tax credits for the premiums are going to expire, the premiums are going to skyrocket. Now, these premium tax credits were put in place by the American Rescue Plan. People are now seeing their premiums go up 2 and 3 times. There's even some healthcare providers that have left the marketplace, and they're no longer, such as HAP, they're no longer offering health insurance through Marketplace. So where are all these people going to find affordable health care? You're going to see millions of Americans back to where they were before 2014, not being able to cover healthcare expenses. So that means some people will probably delay going to the doctor when they absolutely need health care and they need the assistance. And then you're going to see others going to the doctor or in the emergency situation, going to emergency rooms, and they're not going to be able to afford the huge bill that is going to take place. They're not going to be able to afford to pay for the heavy emergency bills and the other costs that healthcare brings. Now let's understand a little bit more about the enhanced subsidies that are going away. Previously, you could earn over 400 times the federal poverty level. And right now, the federal poverty level, I think you can earn something like $15,650. For a family of 4, the poverty level is considered $32,000. So you could earn over 400% above the poverty level and still qualify for these extended subsidies up to a certain point. So in other words, if you're a single person, you could earn up to $64,600 before your subsidies would go away. As a couple, you could earn $84,600. And if you had a family of, I think, 4 or 5, you could earn somewhere over $132,000 and still get those subsidies. So again, in 2026, we don't have these benefits. So this is going to drastically hurt a lot of people. So in 2026, the premiums are mainly going to be based on where you live, how much you earn, how many people are being insured under your plan, your health, and whether you're a smoker. Your age also will play a role. So let's talk about what type of plans right now Obamacare offers. Well, you've got the basic plan, which is your bronze plan, and that's typically for people who don't go to the hospital very often. Therefore, you have lower premiums, but should you use the insurance, then that's when the deductibles are higher. So the more you use the healthcare, the more you pay. So again, if you're pretty healthy and you're young and you need health insurance, I would say go with the bronze plan. So the next plan is the silver plan. And that's a plan that previously I'd used. Now the silver plan, that's for people who are in pretty good health, but you still go to the doctor probably a little more regularly than other people who don't use healthcare too much. So that's like a mid plan, right? So it's right in the middle. So it's a silver plan. The premiums are slightly higher, but the deductibles are slightly lower. So for me, that was a good balance. And then you have the gold plan. The gold plan is for people who typically go to the doctor more frequently. So your monthly premiums will be high, but your deductibles will be lower. So it's really up to you to decide what type of healthcare you need based on how often you go to the doctor. And again, with the Obamacare still being in place, though some of the subsidies are going away, people with pre-existing conditions can be reassured that they will have health care. So the affordable health care, who is this best suited for? Well, if you have pre-existing conditions and if you earn somewhere close to the poverty line or much less than $64,000 a year, then this is likely the plan for you. Also, if you're someone who absolutely need insurance, you have to have it. Maybe your employer does not provide it. Maybe you're a business owner and you're just getting your business off the ground and it's not earning a lot of money. This is definitely still a good plan. Now, for middle Americans, we're the ones who are going to be hit the hardest. And aren't we always? Unfortunately, if you earn a decent income, the government says we're not going to give you subsidies. And again, if you're a couple earning over $84,600, you're not going to qualify. So for a person like me, middle American, and you're 50 years old, and you're in really good health, my premiums are still going to be somewhere around $800 if I went through Marketplace. And they can extend all the way up to $1,200. And that's per person. So again, is this really affordable? No. Personally, I think healthcare should be affordable for all people, rather you're low income, middle income, and for the wealthy, they really don't have to worry about it because they've got their healthcare covered. They earn enough money for it. But what's going to happen is, unfortunately, for some business owners who are right there in the middle, they earn a decent income, but still maybe they don't want to pay $800 to $1,200 a month in healthcare coverage, in premiums. So what they likely might do is find a way to go back to work, maybe work somewhere part-time, maybe even full-time, just so that they can obtain the medical benefits. So I hope that our politicians get it together. I hope Congress decides to extend these tax credits, because middle Americans, we need this tax credit as well. So thank you for watching Financial Fix with Sharnella. If there's a topic that you would like for me to speak on that I haven't spoken about before, please put it in the comment section. In the meantime, if you enjoy my content, continue watching and like and subscribe.